So welcome. We are here at the New Wave of AI for Healthcare conference. I'm Thomas Fuchs. I'm the chair of the AI department at Mount Sinai. And it's actually my big pleasure to talk to Joachim Buhmann. Professor Buhmann is one of the leading machine learning experts in Europe and built the whole ecosystem in Europe together with his peers over the last decades. And it's really an honor to have you here, Joachim.
Thank you very much.
So let's dive into it. Your keynote talk today was received extremely well because you were also critical about the state of affairs, especially in deep learning, and you really put focus on the model validation part and all the advances you and your research team made in that area. Maybe you can briefly address that.
From my point of view, it's very clear that the paradigm shift is the way we build models now in with machine learning compared to how we did science before. And human experts were the masters of modeling. In the new technology, the computer is doing the modeling. The human experts are setting up the computer to build models and has to make sure that these models are actually learning something about reality, and that requires that they are validated. It's not verification, that's what computer scientists know quite well. Validation is that the model, that the programs, which are ultimately then used in decision-making processes, are giving you justifiable suggestions and making the right proposals for diagnosis, prognosis, and therapy with outcome prediction. Mm-hmm. That's the challenge. And human experts then abstract from the modeling domain where they build the models to the model control domain where they control the modeling building process which is going on in a data-driven way with these machine learning algorithms. Mm-hmm. That's a big step.
So you showed very nicely in your talk that you can set up a probabilistic framework to actually evaluate or do model validation in a more principled way. So in healthcare, we are of course in a regulated space, and when we talk about validation, mostly of systems, of AI systems, then ultimately that has to go through the FDA in the US or through the IVDR in Europe. So where do you see the combination between the really principled probabilistic approach and then the empirical validation approach for safety, efficacy, and equity from the regulatory side?
I think the regulatory framework is more to accompany the further development of current technology. What you do in deep learning and with this technology which now shows amazing performance, that's why so many people are so impressed by ChatGPT. Mm-hmm. It shows amazing performance, and you need guarantees, because having a chat which goes slightly in the wrong direction, you can hit the reboot button and start it again. If you make a decision in medical treatment, often it's too late for the reboot button, so the consequences are more dramatic. But that has been a challenge for medicine all the time. And medicine is not only accompanied by successes when human experts were doing it. In Germany, we had the Contergan case. There is the debate of statins. Are they good, bad, and so on. There are so many experimental findings, and I think we have to accept that as a fact of life. But we also have to systematically better train people to deal with uncertainty in situations which are very complex. And in the end, I think we should be also optimistic. Despite the fact that we are confronted with enormous complexity, including the interaction with these tools from AI with that complex domain, we are getting older. So we are not making everything wrong.
That's very true. So pointing on the complexity side, I think we both agree that we soon will have systems that certainly go far beyond in modeling complexity, then we humans can understand that. You brought the example from the genomic side. Another example would be, of course, just looking at a single cell, right? The processes that go on in a single cell are not produced by humans like language, but by biology and physics, and that go far beyond than we as humans could ever conceivably understand as a whole system. But AI might, and hopefully will, because it would be very useful. So imagine a state where we have these very powerful, complex AI systems we don't completely understand. How does then validation look like?
We have, okay, if we cannot validate these systems, ultimately we can't use them because we have no guarantees on outcome prediction. It would be very dangerous to use them in such a situation.
But validation doesn't mean human understanding.
Exactly. So I was very much impressed a couple of years ago when I heard that not all the chemical processes when gasoline explodes have been understood. So depending on what we actually require from understanding a phenomenon before we use it in technology, that consequence would have been not to have invented the automotor, or at least not having used it. Flying is another example. A lot of planes crashed until we had the technology under control, and now it's the safest way of transport. So technology has to grow, and we have to grow with using that technology. And the frame, what I'm advocating is that we take it seriously to consider validation not sort of as a byproduct which you have to make in order to sort of counter some arguments which you are faced in court. No, it's the core scientific challenge when machines build other machines, when algorithms invent models. So that was our sort of trademark as scientists over 5,000 years of science. We were inventing the models. And now we see the models are getting so complex and still are predictive that we can't process them anymore with our brains.
Right.
So the machines, the computers are processing them, inventing them, and we have to make sure that they still tell us about reality and not about a fake reality which came from misprocessed, poorly processed data or whatever.
Yeah, I couldn't agree more, of course, but the positive upside is that will deliver us tools, especially in healthcare, to go far further than we could go today, where a lot of the things that are still used are just totally limited by human imagination.
Yeah, and as we also saw in the discussion, what is the mega trend in AI when it comes to society? It's the personalization of tools, of services, personalized education, personalized healthcare, and so on. Personalized advising in financial matters and life management and so on. What does personalization mean? You go to smaller and smaller comparable cases which are similar to your situation, which means that the statistics is getting poorer and poorer the better the personalization is. This is a trade-off. For this situation, we have to learn a new statistics which can help us to still deliver services which we can justify and where we could actually quantify the success rate in such a way that we also are willing to take risks when success is not there. If we don't do that, we are victims of our belief that you cannot do anything when you can't understand it, and this is clearly wrong.
Yes. I think that's a great note to end on. Joachim, thank you so much, not only for your talk, but all the work you're doing, all the science you're driving forward. You're, of course, a pillar of machine learning and AI in the world, and thank you so much for joining us.
And thank you very much that you invited me and that I could address an audience with a message which may not so easily to digestible, but in the end we all have to work on reshaping our view of the world, because that technology doesn't give us an alternative.
That's right. Thank you.